Hi there, I am Stacy Phillips, and I am so excited to kick off season 1 of my podcast, Stacy Phillips and Friends, or as we like to say, keeping it real with non-housewives. No slight to real housewives. We really love you. Everybody needs a housewife in their life. Each week, we will step into my wardrobe, literally one of my closets, where one of my nearest and dearest friends and confidants will fill this chair next to me as my co-host to chat a little bit about life and a lot about women empowering women. Together, we will have a gap session with just us gal pals, a deep dive for the dish, a convo among co-eds, and then our big feature presentation, the special guest interview, or what I call the SGI. But first, move over, Andy Cohen, with your mazel of the day, because at Stacy Phillips and Friends, we will bump it up a notch or 3 as we Kibbitz, Kvetch, and Kvell, the best 5 minutes of commenting, complaining, and crowing. And because I am a divorce attorney, my producer, George, will drop in to spend a few minutes of each show talking about a high-profile relationship in the news. So welcome to Stacy Phillips and Friends. Let's keep it real. Hi there. I'm Stacy, and welcome to Stacy Phillips and Friends, or as we like to say, keeping it real with non-housewives. And we do love housewives. My co-host today is my dear friend, Dr. Tiffany Grunwald, one of the women I most respect in this world, and I expect you will too. Tiffany is a world-renowned, board-certified plastic and reconstructive surgeon who has been helping patients achieve their desired aesthetic since opening her Santa Monica private practice in 2007. She's got a really cool story, which she will share with you. Tiffany has worked extensively with breast cancer survivors to restore their natural beauty following surgery. She was drawn to plastic surgery because of the close relationship that develops between doctor and patient and her role in analyzing and solving problems that directly impact individuals. How much more direct can you get than reconstructing your breast after cancer? God bless. Dr. Grunwald was an honor student at University of North Carolina, Chapel Hill, and USC's Keck School of Medicine, where she was awarded tops in her class. In addition to her private practice, she is also the division chief of plastic and reconstructive surgery at Providence St. John's Health Center. That's only the tip of the iceberg. And please, Tiff, tell the story about your career. As I say, it's sort of backwards. Please share.
It is. And, you know, there are many people who kind of want to be a doctor from the time that they start. And I will say I was always math and sciences, but I went through many iterations of what that was, something in science. And I started college. I dropped out halfway through my sophomore year. I worked, and then I went back to community college, and finally transferred to the University of North Carolina, Chapel Hill. So I graduated college 10 years after high school. That was a 10-year journey.
And after you were married, right?
And after I was married.
And had children.
I did. I had my first child in the last year of medical school. I saved up all of my vacation to do that. My husband at the time, when we got back from our honeymoon, he said, "You keep saying you want to go back to school. Why don't you?" I don't think he thought I would do it for 16 more years, but that was. So look, it's an interesting journey, and I think we're so driven to find exactly what's the right thing, and you kind of just have to leave yourself open, and you have no idea what's coming down your path and who you're going to meet that's going to change things. And I was blessed to meet a lot of amazing people, and I went on medical missions as a translator, and that's really what kind of got me interested in medicine.
We plan God laughs.
Exactly.
And we were just joking before that many parents say, "Oh my God, if my child doesn't get into the right daycare or the right nursery school, his or her life will be over." And here, you're a great example of doing it in a different way, and look where you ended up. God bless.
The journey's still fun.
I'm so excited about our special guest today. How about you, Dr. Tiffany Moon, another Dr. Tiffany, and share about the story with your name. I thought that was pretty funny.
So I was telling a story, and I'm a little older than Dr. Moon, but when I was interviewing for medical school, I'm just going to say it was the University of Chicago. So I was there, and I was interviewing with this elderly gentleman, and we had this interview, and then as I was leaving and I had my hand on the doorknob, he said, "I don't think they let people named Tiffany become doctors."
I just judging a book by its cover.
I know.
But hey, he'd be wrong.
He'd be wrong. Definitely be wrong. You have 2 examples here today.
So, I love fashion. So let me give a couple of plugs for my favorite designers. Of course, Christian Dior and Acris, but I'd rather talk about ones that are close to home for people who own it that I love. Taryn Rose, orthopedic surgeon, fabulous shoes.
Yes.
Enrico Queenie, Frank and
Had a
Eileen.
couple of his made.
Yes, fabulous. Frank and Eileen by Audrey McLaughlin. That's a lot of my sweats, my cotton shirts, perfect cotton, pants, etc. They do make dresses. Mine dresses tend to be a little fancier for work, and Audrey knows that. And Jennifer Shamandi, I am wearing her shoes today. Let me pull that up. Gorgeous. And she also does bespoke, and I have a lot of shoes that only I have because she made them for me. She was in the financial world and decided, I'm checking this. I want to do.
And do you wear your heels all day long?
I do.
I do too. But only Jimmy Choo and Stuart Weitzman are kind of the only two.
Well, you should try Jennifer and Taryn.
Okay.
You know Taryn.
I do know Taryn, and I have two, but these are still my favorites.
Her largest group, Taryn's largest group of clients,
Yes,
are physicians.
yes, she's come to. So we have these conferences,
Yep.
female plastic surgeons, and she comes with and
Yep.
make it, and they we all sit there, and it's amazing, and they're
And they
beautiful
brush
shoes.
with your feet. Yeah.
Yes,
I was wearing a pair of her slides today, and I went through COVID wearing her slides virtually every day. So a lot of women were wearing flats, and then when they tried to wear a heel, they couldn't.
They couldn't go back.
Plantar fasciitia from
fascinating.
walking around,
Yeah.
how you pronounce it, with flat feet. But I wore her slides, and it was fine.
That's amazing.
There's my producers telling me it's time to get going on our Kibbitz, Kvetch, and Kvell. So for those of you who don't know, Kibbitz means to chatter, to gab. Kvetch means to complain. And Kvell, as my dad would say, means to bust your buttons. So Tiff, you get a choice. You can either Kibbitz with me on something. You can Kvetch, which I prefer not, or you can Kvell about something. Maybe the walk you did today, but take your pick. It's yours.
We can kibitz about the bike ride we did today. So this is my breast cancer survivor group, the Breast Goddesses, and we went from Santa Monica Pier down to Manhattan Beach. So it's 11 miles. You know, it's the breast cancer survivors. Sometimes they'll bring a spouse or a kid or a friend or someone else. Most of them are my patients, but some of them are other people's patients who just find us. But it's just a great community. You know, it's
How many doctors?
just me.
You should bring Christy and Medigay.
So Christy has done several.
Mm-hmm.
She's done the Malibu Triathlon with us, Christy Funk. And when we do the Malibu Triathlon, we get several physicians in there. During the year, we kind of do these littler things. But when we did the Malibu Triathlon last year, we had 32 teams, so 96
Wow.
athletes, anesthesiologists, physical therapists, nurses, a bunch of breast surgeons, and other plastic surgeons. And we just support the patients. You know, we build the team so that they can do whichever event they want. We do it as a relay. But, you know, I think, you know, today it's always fun for me to hear. I think for a breast cancer patient, no one knows what they've been through except someone else who's been through it. And they don't have to talk about it. They just know. And they know that they're kind of badass, right? Like they've done this. They've already had surgery or chemotherapy or radiation or
all of
three.
the above.
Correct. And so they just get to know that these other people know they're strong.
And I assume there's a support system for each other.
Yes.
You don't feel so alone.
They do. They talk about things like, did you get tight here where you're radiated? Or I found this great top that hides like the scars here. And I love hearing that. Like it's an amazing support.
God bless you. That's really, really important. Do I hear the sound of crying or is it laughter? It's always laughter on this show. No crying. Let's turn the sound up because it's time for our relationship roundup. So, Georgie, are you prepared?
Hi. I'm ready. Although there'll be no crying today because this is just happy news, happy thoughts, happy vibes.
Who are we talking about today, Tiff?
What are we talking about with a relationship? Whose?
How about
Well-
Wells Adams and Sarah
well,
Hyland?
Wells.
Wells.
Wells Adams and Sarah Hyland. So you guys remember Sarah Hyland probably from Modern Family. She was the daughter on Modern Family. She's really pretty. She hosted Love Island, and now, which Love Island is like very, very popular right now. She's not hosting it anymore though. But yeah, we were just talking a little bit about her and Wells and their relationship, and kind of where it's headed. Wells and her first met on social media. So just like me and Daryl, my husband, we also met on social media. Wait, Stacy, how did you meet Brad online?
Nope. We were introduced by a mutual male friend.
Okay.
I'm lucky, the old-fashioned way.
Comes through, mutual male friend. We love that. People are just wondering when they're going to have a kid, yada, yada, yada. I hope soon for Sarah's sake. It seems like she'd be a really good mom. Wells is super cute. Actually, my mom is friends with his mom a little bit, or they know each other. So I have a bit of a connection with Wells. But yeah, they're just like a fun couple that's doing really well right now. If you guys watch The Bachelor, you would know Wells from The Bachelor. I don't remember exactly what season he was on, but he was a contestant on The Bachelor. Was he a bachelor too? Does anyone know? Daryl, was he a bachelor? I don't think he was. No, I don't think he was.
And
Daryl's not
now
listening.
on Bachelor
was
in
a bachelor.
Paradise.
He is on Bachelor in Paradise. He was a bachelor?
Wait, he's on Bachelor in Paradise, but he's married? That can't be.
Well, because he's
No,
the
no, no.
bartender.
Yeah.
Oh, he's
He's
a
the bartender.
bartender. Okay, well,
And
that's
Yeah.
safe.
he's exposed to all these beautiful women. That's actually one show that I've watched a little of, and it's like, wow. So you got to keep it together, not be drawn into the relationship since you have a relationship of your own.
Yeah, I just think they're a cute couple. I just wanted to kind of bring them up on the pod. I'll show you their wedding photo.
Oh,
Wow. Beautiful. That looks like in paradise.
yes,
Yeah,
it
my
does.
friend actually, my friend did the makeup for that wedding
Wow.
for Sarah. Yeah, she's gorgeous.
Where was the wedding?
I think it was like in Italy or something like that. It's definitely somewhere overseas. Yeah, people just want them to have kids, so pressure's on for them.
Not from their parents, but from the community at large. So best of luck to them.
Yeah, good luck to them. And I think he'll probably be on Bachelor in Paradise again this season. So
we're
we'll see him
sending
there.
them our love and mazel. That's the sound that it's time for our special guest interview, my favorite part of the show. This week, we are very excited to spend some time with Dr. Tiffany Moon. Now, no, we didn't plan this intentionally, but we have two Dr. Tiffanys. So Dr. Tiffany Moon is a mother, wife, entrepreneur, anesthesiologist, and TV personality. She graduated from medical school at the top of her class from UT Southwestern at the age of 23. That's quite young. She is currently an associate professor of anesthesiology at her alma mater. She has garnered numerous accolades, including the Dennis Landers, MD, PhD, Faculty of the Year Teaching Award, Distinguished Educator by the Society for Education and Anesthesiology and the American Society of Anesthesiologists. Named among best doctors several times, she's an oral board examiner for the American Board of Anesthesiology, published over 50, original manuscripts, reviews, and book chapters, and speaks internationally. Tiffany is also the CEO of I can't even pronounce it. Can you pronounce it for me?
It's Aromasthesia.
I love it. I think it's so cute. It's a great name.
Aromasthesia, Candles, Three Moons, Wine, and Lead Her Summit. I love the names of your companies, so you have to tell us all about it. You express your creativity and humor through your TikTok channel. You're both an entrepreneur and philanthropist, particularly within the AAPI community and for organizations such as the Family Place, Wings, and Face Forward. So before we really jump into this, with so many career highlights and milestones, did I miss anything in your long list of a CV?
No, you pretty much got it all.
So welcome to my closet. Literally, we're sitting in my closet with beautiful clothes around. You clearly take the way you look and put yourself together seriously, as does Dr. Tiffany Grunwald. And I think that's really important. I'd say our generation of women, but I'm older than you are and older than you are, but closer.
Only, yeah.
So from doctor to housewife, how did that happen? Or did it go the other?
No, I mean, I never thought I would be a real housewife. Like when I was graduating from medical school and you told me I was going to be a real housewife, I would have been like, no, like what brand of crack are you smoking? Like that's not a thing. It happened accidentally, as sometimes opportunities arise. My friend Deandra had been on Real Housewives of Dallas in season 2, and I had been to several events where before you go inside the venue, you have to sign this piece of paper saying that you know they're filming and you might appear on TV or whatever. And I guess I caught the eye of some of the producers, and they kind of said to Deandra, like, aren't you friends with Tiffany? Like, ask her if she wants to be on the show and all that stuff. So the first time she asked me, I was like, absolutely not. I was working full time as an anesthesiologist, raising twin toddlers, like literally in the middle of potty training my twins. And I was like, no, I don't want to be a housewife. And then she asked me the year after that and the year after that. And I was like, you know what? I'll take the call. No promises, but I'll take the call. And the rest is history.
Wow. I should have said housewife with a capital H. Kudos to you. And what's that experience been like?
I mean, it opened a lot of doors for me, so I don't want to, bite the hand that fed me, but it was a very challenging experience, not because of the filming and not because of the way I was shown on TV, but quite frankly, because of a lot of the interpersonal conflict that I had with a lot of cast members. Like, naive me to think that I was going on the show to actually have fun and make new friends. Like, how naive must I have been to think that? But I really did. And of course, for anyone who's seen the show, or if you haven't, I'll save you the trouble. It was a complete disaster. I made no new friends. I embarrassed myself. And when they asked me if I wanted to do it again, I was like, I think not.
You are not the first person who has been a guest on this show who has told us the exact same story. And a friend of mine who considered being on Real Housewives here in Beverly Hills was counseled by another friend of ours. If you think you're going on the show to make new friends and to have everybody get along, guess again, because the show's intent is to create conflict. So your approach and your desire and your goal is laudable, the way I would approach it, but sadly, that's not the franchise.
Yeah, I mean, I didn't think we were all going to sit around and drink tea and be nice. I understood that the show was, based in interpersonal conflict. I just didn't think it would be that much. And I kind of thought that it was like manufactured for the show and that off camera, like everyone would be friends. And I certainly didn't think that any of my castmates would try to go after my medical career and everything I've worked my entire life for that you just read off during my introduction. So I think, I was naive to think that it was like contained drama. And then when it spilled into my real life, I was like, oh no, I'm not doing this anymore.
So what kind of doors has it opened for you?
It really grew my social media following. I don't think it made me on social media. I think by the time Housewives aired or was taping, I already had hundreds of thousands of followers on social media, but certainly there was a spike when the show was airing on Bravo. I grew a lot of followers. It opened up the door for me to sort of be myself and be authentic. And what I mean with that is being a, professor at the university, I always kind of hid a little part of myself that enjoyed fashion and beauty and skincare and humor and doing funny dances with my family and drinking wine. Like, I hid those things from my public persona because I thought that if people found out I liked to do all of those other things or had an interest in, God forbid, anything besides medicine, that it would diminish my credibility as a physician in the community. And I was scared of that. And so what Real Housewives really did for me was just blow the can off that. Like, I just went all out. I was like, you know what? I got early promoted from assistant to associate professor. I am a damn good anesthesiologist. I am a good mother. I am a, upstanding citizen of my community. And if I need to let my hair down and have a few glasses of wine and dance and talk about fashion, like, so be it. And if you don't like me because of that, then that's your problem.
Well, and love that. It's precisely because of that you are joining us on the show. I mean, we are literally in my closet. We have 2 doctors. I'm a divorce lawyer. Fashion, friendship, being a woman, empowering women, not being in a little box is what's important to me. And if you all can't be that way, then I feel sorry for you. And that's why you're here, because you can be that way.
Yeah,
So
I feel kind of bad because sometimes I take Zoom calls from the closet, but my assistant gave me a brief of the podcast, and she said a top plastic surgeon and like celebrity divorce lawyer, and I was like, oh, they gonna be serious. I better do it in the study. And so here I am in the study when we could have both been in the closet.
That's amazing. I love that.
yes, we're women. One of the things my dad taught me, and I'll go back a second. When I was a summer associate at a large firm in LA, even though I'm from New York, I was told that I look younger than who I am. And so to be taken more seriously, I needed to put my hair up, not my head up, my hair up and wear dowdy clothes. And that did not resonate with me. And my dad was a senior partner in a law firm in New York and the head of the summer program at his firm. And I talked to him about it, and he said, oh my God, no, be a breath of fresh air, be who you are, be feminine, and, not with the looking like a man, unless you want to look like a man, but be who you are. And here, look at us. We're all in fashionable clothes and taking our fashion and our careers and our families very seriously, which is why you're both on the show.
I love
So-
that.
So thank you. Thank you. So tell us more about your philanthropic work.
I would say that a lot of my philanthropic work centers on helping women. My parents immigrated from China, and I stayed with my grandparents and came to the United States when I was 6 years old. We grew up in very, very humble beginnings. We lived in an apartment. I didn't know what like a freestanding house was until I was 10 years old, and I got my own room. That was like the most exciting thing ever. I just have a passion for helping women because I think every time you help a woman, she then takes it back to her family and her community and like pays that help forward. I just see like the ripple effect it has when I help women. So there's 2 organizations here in Dallas that I really devote of my time and energy to. One is the Family Place, which is the largest provider of domestic violence services in the state of Texas. Last year, we helped over 4,400 families who were affected by domestic violence. And I've been on their board of directors for, almost 5 years now. And then the other organization that I help support used to be called Wings, but now they changed their name to Ascend Dallas. And they have 2 main components of their philanthropy. One is to help women who are pregnant get adequate prenatal care for their unborn child and the first year of that child's life. And then the second component is helping women learn how to manage their finances, maybe help recover their credit score, take out loans, do mock job interviews to help them get jobs out in the community, that sort of thing. And I see the women and the families that we're able to help. And I'm just so passionate about helping these families because, for a while there, when I was young, I was sort of on the receiving end of a lot of philanthropy. And now I get to pay it back by giving back to my community.
Both of those organizations certainly resonate with me with what I do professionally and what I do in my philanthropy time. What are some of your favorite charities? I know you went on a walk today.
I did. So I have 2 big loves, and one is I have a breast cancer survivor group, and so it is really about for me. I mean, I'm a surgeon, and I do love to make breasts, but that is not what makes the woman whole after breast cancer. And so we do beach walks and bike rides and stand-up paddleboard events. We do the Malibu Triathlon every year as a relay, so everybody just does one piece. But there are hundreds of women who come out and they form a community, and it makes them feel strong. You can do the most meticulous, beautiful surgery, but it is the holistic approach, mind, body, spirit, to make a woman feel strong again after going through something like that. So that's probably my biggest passion. I'm also involved in our community college, Santa Monica College Foundation, where we raise money for a food bank, for clothing closets, so that a lot of these people and I'm one of 5 kids, and only 2 of us graduated high school, and I'm the only one that graduated college. So I realize nobody really knows how to do this if it's not in your family. So the Santa Monica Foundation really helps these young students get through, figure out how to get a job, and some of them are unhoused, and so we do a lot of fundraising for that.
Wow. Wow. The way I was raised is if you do well, you have to do good. And obviously,
Yes.
you feel the same way. So we have two Dr. Tiffany's here. Isn't that cool? So what are some of the biggest issues that each of you feel are facing women's health today?
I mean, I'll start, and it's kind of the same thing that I was just talking about, but I do feel like a lot of medicine now is a surgical approach or a medicine, and that's not the right answer. The answer is that there has to be a holistic approach, and that you have to treat the mind, body, spirit for someone to become fully self-actualized. And that's complex. And our insurance and healthcare industry doesn't really know how to do that. They certainly don't support it with insurance. I think there's a lot of people, certainly a lot of my colleagues, who are very interested in bringing in integrative medicine approaches, because mental health and nutrition, acupuncture, in menopause, all that hormone balance stuff, that takes a lot of work. And so, you know, in our society and in social media, it's like, what's the one fix? I just want one fix that's going to make me perfect and happy. Like, can you just give me that one thing? And it's not the right approach. I think that's the biggest thing facing the biggest crisis.
Well, as a divorce lawyer, I feel the same way. If they get divorced, they think everything is going to be perfect. And just like you look on social media, everybody's always smiling, seemingly having lots of money, and they think everybody's life is like that. It's not.
It's a great point.
Dr. Tiffany M., what's your take on some of the biggest issues facing women's health today?
Oh my gosh, I think there are so many, but I just want to take a moment for the people who are the healers, because I went into medicine because I wanted to help people. And somewhere around, 8 to 10 years out in practice, I kind of was like, is this all? I was helping people. I mean, I do like cancer surgery, trauma at a level 1 trauma center. So I'm doing meaningful surgery, and I don't mean to diminish that, but I kind of just looked around and felt like, is this all I'm ever going to do? And that's when I started like brainstorming about the summit, because when I talk to other women physicians, their pain points that they talk about aren't like, oh, how do I practice medicine, or how should I treat this patient? Like, no, it's running their practice, having difficult conversations with employees, how to market their brand new private practice that they split off and started. Like, all of these are the things that my friends and I talk about when we talk about the practice of medicine. So I started brainstorming, like, how can we help each other? Because we don't need to be siloed and like reinventing the wheel. Like, you're kind of doing the same thing that I'm kind of doing. I want to learn about nutrition and acupuncture and hormone therapy and all those things. So why don't I just bring in all the experts in these fields to talk about their area of expertise? Like, it's not rocket science,
I love your Lead Her series. I went online and read about it, and I think it's fantastic. And just like how Stacy is really promoting women's empowerment, I think you're doing the same thing. Is this mostly physicians, or is it across the board?
It's across the board, but for physicians, we are offering CME because, we need that every year.
Amazing.
But,
Right.
The people who have registered so far, I would say about half are physicians or healthcare. We have like nurses, NPs, RNs, and then half are entrepreneurs, content creators, which is the new word for influencer. I have bankers, a handful of lawyers. So it's like all professional women.
It's super cool. And, it's interesting because what you said is exactly right. We know how to treat patients. We know the medical aspects, like you're a great anesthesiologist, but it's about kind of figuring out the work-life balance that makes you a better physician. Is that kind of what you're finding as you do these How long have you been doing them?
Oh, this is the first one, the inaugural.
Oh, fantastic. I'm so excited. That's great.
Yeah. No, it's
I-
exactly as you said. The challenges in practicing the medicine these days is not in the practice of medicine. It's in finding work-life balance. And just the things that my girlfriends and I talk about when we get together for dinners and retreats and things like that are basically how I crafted the topics of the summit. like one is like legal pitfalls to avoid when, starting a business. What's the difference between an LLC and an S Corp, and how should I file my taxes and all that kind of stuff. Nutrition and wellness, mental health for women physicians. Let me see, what else is there? Marketing and social media, how to create a positive practice culture. Like these are all the little topics that I basically just picked out of conversations that I've had with my girlfriends.
I had my own practice with a bunch of partners and associates and staff for 26 years before I moved my firm to blank room. And I sort of felt alone. Everybody that I talked to really at that point were men. Many of my girlfriends eventually became more entrepreneurial or were in big companies or big firms.
Tiffany, you're so right. It's like, we do all this schooling in so many years, and then we own a business and we have no idea what we're doing.
Correct.
Like I'm just going to keep my head down and keep working. And
well, just like becoming a mom. You don't go to school to become a mom. You don't just go to school to learn how to run a business.
All of a sudden
you have a mouth
to feed.
Yeah, I know how to be a divorce lawyer, but all the other things that go with that. And for me, I look at it holistically, that I have to help my clients with their other professional needs, let alone their personal needs. Going to the gym, having a massage therapist, having a nutritionist, so that they can become whole again.
It's amazing, because you're exactly right. I would never have thought about it like that, but you have to do exactly what I do, which is they're coming in for something, but it's like, how's the rest of your life going? I think that's, as women, the way that we look at things a little differently, right? It's like, okay, how do I help you make sure that everything's in place?
I mean, the other businesses that you have are all part of that. Whether it's lighting a candle and having a glass of wine in a bathtub just to clear your head, having a massage, having healthy food. It's all important.
Yeah.
It's like the cocktail that you make when you anesthetize somebody. Life is a cocktail, and I don't mean an alcoholic cocktail. It is a mixture that you have to have the right balance, or you'll feel lousy. If your propofol and your whatever else is not on balance, somebody's going to wake up nauseous. I've learned that the hard way.
That is the beauty of a great anesthesiologist.
It's really important. And I think women do it really well. I think you may be the first woman anesthesiologist I have met, and you were the first woman plastic surgeon I met. And that's really hard to come by. I think it's really important. Tiffany and I know other breast surgeons similarly, but not plastic surgeons.
Yeah.
Which is a special space. Really important.
Plastics is like one of the most competitive residencies to get into. So competitive, in fact, that sometimes students are advised to pick a backup specialty in case they don't get into plastics. And so for other Dr. Tiffany to be like a board certified, world renowned plastic surgeon speaks volumes to the amount of work that she's done and her leadership skills to be running a thriving practice. And, people are coming to her post breast cancer to reconstruct not just their breasts, but their lives again. Like I just have the utmost respect for the both of you, really.
Thank you so much.
Thank you. So here, a moment for you to promote one of your other businesses.
Yes.
You're on the soapbox. Go for it.
Well, I'm burning a candle here. It's back here. Oh, this is Xanax. It's alprazolam. You can't see,
I love that.
The thing is, when I created Aromasthesia in 2020, I combined the words aromatherapy and anesthesia. And I was like, aromasthesia. It's cute. I'll name all my candles after anesthetic drugs like propofol, ketamine, lidocaine, midazolam.
That's
and
fantastic.
The tagline is candles that smell so good, they'll knock you out. And I'm like, and they'll be funny. And each of them will have a tagline like alprazolam is for humans who are anxious. Propofol is for humans who need a nap. Like it kind of goes with the drug. But this is the thing with like having a business and being an entrepreneur. I tried running a couple of Facebook ads and Google ads to like bring customers into my Aromasthesia business, and all my ads were taken down. We wasted a couple of $1,000s because they wouldn't give the money back because the AI thinks that I am trying to sell ketamine and propofol online, and the ads get taken down. And I'm like,
Whoa.
it's just
Wow.
a candle, like does not contain propofol, but I can't get past like the AI bot or whatever. And I told my business partner, I was like, you're going to kill me. But I think we need to rebrand Aromasthesia and keep the name Aromasthesia because I had that trademark filed with the US PPO office or whatever. And I don't want to change that. But we need to not call the candles like ketamine and propofol or whatever. We need to just call them by their good old scent name because then our ads won't get taken down. And then he's like, but that's what makes the candles special. And I'm like, well, I mean, the wax smells amazing. They're triple scented, they're non toxic, all that kind of stuff. And he's like, yeah, but that's your whole marketing thing. And I was like, I'll come up with something else, So I think after 4 years of having these, we're actually going to start pivoting into another angle.
So what's your Xanax candle going to be called?
I don't know. I mean, I hate to be a boring bitch, but we'll probably just have to call it jasmine bamboo, which is, what it smells like. Like I now I know why other people don't name, commodities after anesthesia drugs. Like, duh, But that
But
was
it's
the
such a
first.
bummer. It was so clever, Tiffany. Like, I love that you did it and thought of it because it's so clever.
So here you have a reconstructive plastic surgeon, you have a divorce lawyer, an odd but not so odd combination. What questions would you have for us?
I love this when I get to ask a question. I want to ask each of you what one piece of advice you would give to a mid-career professional woman in any field who's trying to ascend in her career.
Oof. That is a loaded question, Tiffany. But look, it's a really good one. And I feel like most women in that phase have no idea. Like they're literally just keeping their head down. They've either got kids, job, dog, parents, it's like you're just like, and this is the funny part about the work-life balance, right? It's like there's days when you think, I have everything together. This is awesome. And then there's days where you're like, oh my gosh, I'm so overwhelmed. I'm never going to be able to do this. And so I think it really is getting on that path, which is unattainable, but that you are trying to like take care of yourself. And, there was a point when I took 1 3-day weekend every month so that I, could just escape and get away. And I think figuring out how to wear beautiful clothing and not try to like, fit into whatever it is, whatever field that you're in or whatever life that you're in. I think it's being mindful and cognizant that it's a constant struggle. You're never going to really attain it, but you have to pay attention to it every day.
Well stated. I speak in threes, so let me see if I can come up with 3. One, my philosophy is, I did this for 26 years when I started my own practice and eventually brought it over to Blank Row. I'm willing to take a calculated risk and fail. I am not willing to not take a risk and be stagnant. So encourage young women, if you think about it and you're not just haphazard and you're focused and you do your homework, take the risk because that's the only way you're going to grow. 2, if you do well, you must do good. And at a certain point in your life, you don't have to do it right away. I started writing checks when I was young, but then eventually I sat on boards myself, and then I had my firm be involved in helping other communities, et cetera. And that's a whole nother subject. And 3, there is no work-life balance. It's only balance over time. On any given day, something has to take forefront and something in the back. And you make sure that you're focused on whatever you're doing whenever you're doing it. We are so good at, okay, I'm sitting here with you, but I'm really on my phone and I'm really not paying attention to you. Kids, patients, colleagues, friends really don't want to have that. They want your full attention. Not easy when you're juggling everything, but work towards, yes, and work towards being present and focused with what you're doing. Like my cell phone now is in another room. Yesterday, I taped a bunch of these podcasts. And I came out to, it had blown up. And I was up till midnight answering the emails and addressing them. But I needed to focus on this. And then I focused on that. And if somebody's got a problem with it, I'm human. And remind your colleagues, your friends, they're human too.
Yeah.
So I got 3.
I love it. I also love things in 3s, and I love people who speak in bullet points. I have a colleague who I just stopped asking him questions because he like speaks in paragraph, and halfway through I'm like, forget I asked. Like he talks too much. I can't.
You've been amazing, both you Tiffany's.
It's been so much fun meeting you, Tiffany.
2 doctors, that older white dude, eat your heart out. Got beautiful, smart Tiffany doctors. Thank you all for spending some of your precious time with us at Stacy Phillips and Friends. You can watch me on my YouTube channel. For me to even say that, at Stacy Phillips, or download us wherever you get your podcasts. I listen to my kids who listen to podcasts all the time, which is why I'm doing this. It's, again, getting out of my comfort zone, trying to do something different, being au courant. And don't forget to follow me on Instagram at Stacy D. Phillips, that's for Esquire, or connect with me on LinkedIn. See you again soon. And remember, love will always be in fashion. Health will always be in fashion. Thank you so much.
Bye-bye.